Welcome back. In this video, we'll be looking at the assessment of verbal short-term memory and working memory. In our last video, we explored how the TALSA reveals differences in phonological and semantic level language processing, as well as how it differentiates between different components of signal activation, signal strength versus signal duration. In this video, we'll show how the TALSA examines verbal short-term memory and working memory. Verbal short-term memory is measured in three ways, with repetition spans, pointing response spans, and probe spans. We'll show you an example of each. The digit repetition span is the classic way to measure short-term memory. In this test, the patient hears a random list of digits and repeats them back. While someone with mild aphasia would be able to do this, it would be a problem for people with more severe verbal output impairments, and it would be difficult to determine if errors were due to a short-term memory deficit or to an expressive language deficit. That problem can be addressed with the use of a pointing span. In this case, the patient hears a list of words. They can demonstrate how well they remember the words by pointing to the pictures in order. The arrangement of the pictures changes with each trial. This allows even nonverbal patients to demonstrate their short-term memory abilities. A probe span is another way to assess short-term memory without the need for a verbal response. In this subtest, the patient hears a list of words. For example, ravine, ticket, hallway, cheese. After a short pause, they hear the word corridor. Their job is to indicate if they think that the last word is a synonym for any of the previous words by pointing to yes or no. In this case, the answer is yes, since hallway and corridor are synonyms. This test goes all the way up to 7 words in the target list, which makes it very challenging. This subtest is therefore sensitive to very mild aphasia, which may be missed on standard aphasia test batteries. These were just a few examples of tests of short-term memory from the TALSA. Here is a complete list. You can see that probe spans are divided into phonological probe spans and semantic probe spans. This is another way to look at the differences in these linguistic processing levels in patients with aphasia. Verbal working memory is assessed in the TALSA with sentences, triplet tests, and the category typicality test. The sentence repetition test assesses both input, auditory comprehension, and output, verbal expression. In this subtest, the patient repeats 2 types of sentences, a shorter sentence known as an unpadded sentence, and a longer padded sentence with 2 additional content words. The difference in performance shows how a patient handles increased memory load. This subtest also has a 1-second and a 5-second variation, which, as you know from the previous video, gives information about signal strength and signal duration. Sentence comprehension assesses input processing. In this test, results are compared between processing sentences that are reversible and sentences that are not reversible. In a non-reversible sentence, swapping the subject for the object results in a sentence that doesn't make sense. We can say, "The dog chews the bone," but not, "The bone chews the dog." However, in a reversible sentence, the subject and the object can be switched. The sentences, "The dog chases the boy," and "The boy chases the dog," both make sense. Processing a reversible sentence is a harder task. This synonymy triplet subtest looks at verbal working memory by contrasting how patients do with comparing 2 pairs of words with 3 pairs of words. Here's an illustration. In the first version, the gray box on the left, the patient is asked to point to the word that is a synonym of the word in the box. In this case, the patient has to juggle two word pairs in their working memory in order to come up with the answer. They have to compare prison and cage and prison and jail. In the second version, on the right, there is no box to narrow down the choices. This time, they have to juggle three word pairs in their working memory: attorney and policeman, policeman and lawyer, and attorney and lawyer. The three-word pairs version results in increased memory load and is more difficult for everyone. But some people with aphasia have a disproportionately harder time with the three-word pair version, indicating working memory deficits. Here is a list of all the working memory subtests. The right side of the table describes how the memory load is varied in each subtest. We have included some links to articles for those who are interested in reading more about this topic. In this video, we have explored how the TALSA examines verbal short-term memory and working memory in aphasia. In the next series of videos, we will explore how the results of the TALSA guide treatment. We will discuss treatment theory and generalization, talk about how treatment can be done with your patients, and review how treatments using these principles can potentially improve functional communication skills. First up is treatment theory and generalization. See you then.